Good morning.
Good morning.
I am Elizabeth Davis Russell, a longtime member of this church. I'm here this morning to call your attention to Mental Health Awareness Month. However, as a clinical psychologist and educator, I see every day of the year as Mental Health Awareness Month. Okay. And it is my intent that at the end of my presentation, or at the end of this day, that at least one of you will begin to see and think about mental health in a different way from the stereotypical manner in which society does. Last Tuesday, I went to the doctor. The medical assistant called me from the waiting room and asked for my last name and date of birth, I guess to ensure that she had the right patient. She took me into an examination room and proceeded to take my vital signs, blood pressure, pulse rate. She put on her stethoscope and listened to my heart and lungs. All pretty routine stuff. I remembered one office that I visited where I was asked if I were being abused in any way. I guess it's a mandated question to detect elder abuse. Now, except for the voluminous forms you fill out for your annual examination, there is no routine assessment of mental health until you refer yourself or someone refers you. There is no emphasis on preventive measures. So typically, many suffer in silence because of the stigma of mental illness. Can we ever remove that stigma? Let's take a journey through your day so far. Go back to this morning when your alarm went off, if you set your alarm, or if you're a self-riser, to awaken you. How did you feel? Did you typically focus on your physical being? There's nothing wrong with that. But did you give any attention to what your mental state was? Probably not. And yet, your mental state would more than likely have an impact on how your day would proceed. When you arrived at church this morning and someone asked, "How are you?" Think for a moment. Did you give one of the standard responses of fine, good, or well, thank you? For some of you, those were apt responses. For others, you were either not in touch with how you were feeling or in denial of how you were really feeling. We worry about things, our children, other family members, our health, our financial status. All of these are a normal part of life. How do we begin to deal with these feelings? I would contend that first we need to recognize them and then own them. We need to determine whether we can do something about them. If we can, then develop strategies to do so. Some common things might be Try to get some physical activity. Just 30 minutes a day of walking can boost one's mood. Or engage in some deep breathing or other forms of relaxation. Try to maintain a regular bedtime and wake-up time. Eat regular, healthy meals. In this age of multitasking, I would say do what you can do. Decide what must be done and what can wait. Try to connect with other people and talk with people you trust about how you're feeling. Postpone making important decisions until you feel better. Avoid using alcohol, nicotine, or drugs, including medications not prescribed for you. Now, however, if there's no basis for these worries, and we just can't stop worrying, then it seems to be out of control. Someone who worries very much about everyday things have trouble controlling his or her worries or feelings of nervousness. Know that he or she worries much more than he or she should and feels restless and has trouble relaxing, concentrating, experiences insomnia, and may be irritable. Sometimes may have headaches, muscle aches, stomach aches, or unexplained pain, even going to the bathroom a lot. Do we know any such person? When these symptoms begin to interfere with daily life, it's time for us to seek help. Just as we would not let a broken arm go untreated, we should not let a mental illness go untreated. Treatment is a sign of strength, not weakness. Well, where do you begin to seek help? You might want to begin talking to your health provider. But if you're concerned about how to begin that conversation, I would refer you to the National Institute of Mental Health website, where they have tips for talking with your health provider. And these tips will help to prepare you get the most out of your visit. Now, where do you find services if you know someone who needs those services? The Substance Abuse and Mental Health Services Administration provides the Behavioral Health Treatment Services locator. And from that locator, you can find services within our area, as well as support groups. For additional resources, again, NIMH, that is National Institute of Mental Health, has on its website many resources for mental health, mental illness. Thank you very much.